This episode of Transmission Interrupted was recorded June 2nd, 2025. This is Transmission Interrupted, a podcast series from NETEC, the National Emerging Special Pathogens Training and Education Center. Welcome to Transmission Interrupted from NETEC.
Hello and welcome to Transmission Interrupted. My name is Jill Morgan. I'm a nurse here at Emory University Hospital in Atlanta and part of NETEC and the PPE working group. For those of you not yet familiar with NETEC, our mission is to set the gold standard for special pathogens preparedness and response across health systems in the U.S. with the goals of driving best practices, closing knowledge gaps, and developing innovative resources. NETEC works alongside and in cooperation with the CDC and is funded by ASPR, the Administration for Strategic Preparedness and Response. Today, I get to talk with some of our partners in the healthcare industry and in special pathogen preparedness, folks from our EMS work group from all across the country. So today we have Chad Bowman. He is the nurse manager for the Johns Hopkins Lifeline Critical Care Transport Team and the director of transport operations at the Johns Hopkins Special Pathogens Center. And Elizabeth Lenz. Liz is a captain with the Denver Health Paramedic Division and specializes in high-risk infectious disease transports. Welcome, y'all.
Thank
Jill. You. All right. So I love PPE. People who've listened to this before know this is like my thing. Between waste and PPE, I'm in my happy place. But, I don't think we have talked a whole lot before on the podcast about EMS PPE. And I just want to start out with this question of, for me, in the hospital setting, I might have some signs I look for or something in the chart that tells me that I might need PPE for this patient, right? Whether it's they have a cough and fever or a rash or they have a history of something. But for EMS calls, how do you even know when you're going out to something that you might need PPE? Like, how does that even get started? Liz?
Yeah, so our paramedics recognize the need for PPE while responding to a typical call, starting with the dispatch notes and information. What they get from dispatch includes what the patient is calling for, any signs or symptoms that they self-identify prior to going out to the home, which gives them an indication of what PPE may or may not be needed. A second opportunity is when they arrive on scene and kind of doing that scene size up. What do they see? How is the patient presenting? What is their initial assessment tell them, as well as history and signs and symptoms?
So really, you're using some of the same stuff we do. You're just sort of all in there sometimes before, right? You might be getting a history and go, oh, all right, I don't need to back up. Or hopefully there's some clues in what you're getting from the initial call. Okay. Chad, what do you think?
I think that it can be a little bit overwhelming, the amount of information out there about PPE for EMS especially. So one of the things that we always like to point folks towards is the ASPR Tracy EMS Infectious Disease Playbook, which is a really great resource if you're not sure what PPE you need in a particular situation. In most cases, there are several different types of PPE ensembles that would be appropriate for a given threat. So this playbook breaks it all down for you by the different types of isolation levels. And the good thing about it is that it is encompassing the entire duration of an EMS or inter-hospital transfer, starting from the call taking and dispatch piece all the way to decontamination and clinician monitoring after the transport is completed. So a really good resource overall.
Wow, I love that. And we can link to that at the end of the podcast. I want to step back for just a second and kind of zero in on some of this, because I think we use the phrase transmission-based precautions a lot, right? A lot of our folks that are interested in a podcast like this or affiliated with NETEC are infection preventionists. So transmission-based precautions is really just part of our everyday lexicon. But part of that relies on you having some clue about what that pathogen is, right? That's almost something that could only take place once you've got this list of, maybe it's a short list, maybe it's a really long list of potential cooties that this person could have. So it sounds like, at least in the EMS sphere, while certainly you guys still have transmission-based precautions and obey those kinds of things, that a lot of this is more syndromic, right? Like if somebody's got symptoms, you're letting that drive part of this. And I think that's so critical to protecting each other, is that idea of you're going to go in there and make contact. How do you protect yourself when you're doing that initial, I can't take it back, right? Once I've inhaled it or God knows, hopefully not touched it, but whatever it is, I want to protect myself before that happens. So what kind of options do most medics and EMS folks have at their disposal? I mean, we have a supply closet, right? It's got all sorts of stuff in it. And then when somebody's on isolation in the hospital setting, typically, you get whatever's appropriate for that, either in a cart or something that hangs on a door or whatever. But is this all just somewhere tucked into a secret cubby in the truck? Or like, how do you guys know what to take out or what to bring with you? And what all do you have to choose from?
Yeah, so here at Denver Health, we have a couple different layers of PPE. Every ambulance is stocked with gloves, gowns, eye protection, and surgical masks. Our paramedics are also issued N95s at the beginning of their shift, and they're able to come back and trade out N95s if they need a new one, should it be soiled on a patient transport or whatnot. Then additionally, all of our command staff carries a red bag full of a little bit higher level of PPE. This includes things like Tyvek suits, coveralls, rubber boots, boot covers, sort of some additional protection, as well as the stuff that we need to make the ambulance safe to transport, because we can't always put the driver in the same PPE that the patient provider is in. So those bags include all of that material. And then our highest level being PAPRs, which is reserved for our high-risk infection transport team. But we do have enough stock here at Denver Health to deploy that in a larger capacity with just-in-time training if needed.
Yeah. And so, Liz, thanks. I want to just say PAPR, powered air purifying respirator, a powered filtering respirator. So for particulates, that's a perfect thing for things like infectious diseases. My guess is that y'all also have this whole array of PPE that you use for the other things that you come in contact with, right? And that's the stuff that I think from the hospital side, like I rely on y'all in many cases, either decontaminating somebody or limiting the contamination by like taking their contaminated clothes off them or whatever it is, so that in the hospital side, we do very little with like a chemical suit. But in EMS, you might have like the driver of a truck or an industrial accident and have to go in and sort of wade through that stuff.
Yeah, so we work very closely with the fire department here in Denver, who runs the hazmat side of things, and lean on them for which PPE we need in certain hazmat situations. But you're absolutely right. And our paramedics are very well adapted to use what they have on hand to try to minimize the risk of any sort of spread or contamination from patient to provider.
Excellent. Excellent. Chad, is it about the same in your world?
Yep. It's about the same in our world, slightly different. At Hopkins, we have the advantage of having time. And we know about our patients generally ahead of time. We're not responding to an accident scene to pick up a patient or to somebody's residence to pick them up, to bring them into the hospital. So we're finding out about our transfers through our access line. And we have the advantage of being able to actually talk to the person on the other end that's caring for them. So, we talked a little bit ago about those symptoms and syndromes, and we oftentimes are able to identify those ahead of time. So if we have a situation where we need additional PPE beyond what is carried on our trucks, and in Maryland, that is guided by our state EMS regulations. And, it's your standard basic infection control PPE, as Liz mentioned, but we are able to add on additional items of PPE as needed based on what's going on with the patient. So if we have an airborne patient, for instance, and we're going a longer distance, we may elect to use PAPRs instead of having our clinicians wear N95s during the transport. So we have some options and definitely have the advantage of time in most cases.
Yeah, that makes sense. And I think for all of us, having that extra bit of time, not just to put on PPE, which we all know takes longer than anybody thinks it's going to, but also I think that time of thinking about, okay, so what am I going to be comfortable enough? Will I be able to sit in this or talk with them or whatever for that length of time? Yeah, I think being able to tolerate your PPE is such an important part of the safety of it. A lot of folks want us to sort of prescribe, well, what should we have? Well, okay, these are the issues that make that a really complicated question, right? It was like, okay, if it's going to be a long transport, if my N95 is super uncomfortable, if my patient's hard of hearing and they might need to like read my lips, like there might be some things I need to consider about all that. Yeah. And I guess for us in the hospital, here, my husband will call and say, how's your day going? And tell me what the weather's like. And no matter what it's like here in Atlanta during the day, it's 72 and fluorescent where I am. And that's not true for y'all, right? So you're going out, your PPE has to be able to slog through some stuff, right? So I'm really curious I would love to hear some sort of, I don't know, either war stories or tips and tricks about PPE and things like weather and the tarmac and all those conditional things that the rest of us don't have to think about.
I think I would say probably looking at the things that we're doing and comparing that to the type of PPE items that you have and do they actually work for you? And we learn a lot about this through training, drills, and exercises. I think probably for us, heat is the biggest challenge. We operate in a different environment, as you said. So we might be picking somebody up at their home, transferring between two hospitals. And I think that we're really concerned about the duration of time that we're in PPE. Another consideration would be if we're picking a patient up at an airport and we're in PPE outside, how is the wind or the environmental conditions affecting your PPE outside? So we did a drill recently at Dulles where we practiced receiving a patient from Phoenix Air on the tarmac. We had providers in PPE. It was a fairly windy day, and we were able to see how our PPE interface with that environment and the gowns wafting up in the air. So definitely it gives you some things to think about as you look at your ensemble overall and how you might make changes. I think another thing that we saw, depending on the type of isolation gowns you had early on in COVID, we were picking people up at home and bringing them in to be directly admitted to the hospital. And we found that having bigger EMS guys trying to carry a patient down their front steps in a stair chair, we were finding a lot of times that we were breaching the PPE because either like the neck would rip or like an arm would rip because they're, just the position that they're in carrying that chair down the steps. So making modifications based on that. And we actually switched out to a surgical gown, which was a little more durable during those times so that we weren't having PPE breaches. So I think it's really important to you have to know what works for each situation, and you learn a lot by doing, and then you're able to make small adjustments as needed.
Yeah. And you don't want to be in the middle of one of those events, right? A breach event. Suddenly there's a tear or it doesn't fit or whatever. And especially when you're in something that's very high risk. And some of these pathogens just have a very low infectious dose. And that means the margin for error is super small. Although I had to laugh, Chad, because I think every woman on the planet is used to this concept that there are things that women buy that come in one size fits all. It's supposed to say one size fits all. And for most of us, it's like one size fits, we're not sure who, but it's not me. And so it's funny to me that this is the male equivalent, is you all putting on an isolation gown and realizing, this is not going to work. Yeah, absolutely.
And we were also referring to the gowns blowing up as the Marilyn Monroe effect.
Yes. I was thinking actually about the papper hoods because I've seen those flip up in front of somebody's face. And all these things have to be really thought about ahead of time. But I think your point is very well taken, that these are the things you learn once you're wearing the ensemble. There is no substitute for that experience to help you modify and change and improve either what you're using or how you're using it. Yeah, absolutely. Liz?
I would just echo what Chad said, that really thinking about the elements is something that you have to be really cognizant of. I know during COVID for us, our paramedics all wear white button-down shirts with badges, nameplates. Our command staff all has bars or stars on their collars. So we actually changed our entire uniform during COVID because of isolation gowns ripping on all of our required pieces of equipment. So we changed to t-shirts during that time just to make things a little bit easier and minimize the potential for a breach. I think one of the biggest challenges outside of weather factors and environmental conditions is just following COVID, there's a lot of PPE burnout. So we are currently struggling with even just keeping PPE front of mind of our paramedics. I'm very fortunate that I have an amazing, dedicated team here in Denver that helps educate their peers on a day-to-day. We do as much as we can to remind people that that is the best way to keep you safe. So really fighting that post-COVID has been one of the bigger challenges outside of the environmental conditions when it comes to PPE.
Well, I am glad that you mentioned that, because I think, first of all, it's a subject that's really near and dear to me, because I think I wish that we had taken the opportunity that COVID presented and continues to present and really empowered our frontline healthcare workers to understand what their PPE does and doesn't do, to choose what they need based on what they're going to be doing with a patient. And maybe that's a little bit more nuanced than a lot of facilities or companies want to think about, that there's this ensemble for this thing, but you're not always in the same role, right? It might be different whether I'm just pulling a trash can out of a room or whether I'm going to sit in there and brush somebody's teeth or do their mouth care or attend to their ventilator. So I think that I really wish we'd empowered people, because all of us, EMTs, paramedics, physicians, nurses, aides, everybody across the healthcare spectrum deserves to go home at the end of the day and not take somebody else's cooties with them, right? Whether that's RSV or MRSA or COVID or tuberculosis or Ebola, right? I mean, from soup to nuts, as they say. But I mean, none of that. We have a right to not be exposed to that stuff at work. And I think we've all kind of gotten sort of just used to this idea. I think if you asked most healthcare workers and probably most medics, do you think you've been exposed to a list? They'd say, oh yeah. I mean, it's just part of the job. Let's try to make that not true, right? You're absolutely right. We had this conversation not long ago. If somebody comes in or runs into the fire station, or you're presented with somebody that, somebody hands you a limp child, you're going to take that child, right? I mean, that's part of our job. That's why we went into this industry. But that's not what happens every day. We need to protect ourselves on the daily for everything. And really, I would love for people to know more about the qualities and the characteristics and, why some things work better than others. So that's my little soapbox.
I couldn't agree more.
Thank you.
I think just engaging your teams, their input on the PPE is important too, because as was mentioned, that PPE burnout, if you have an ensemble and pieces of PPE that they have worked with and are familiar with and have vetted it, they're going to be more likely to utilize it. If you're pushing out something that the leadership hallway has picked out and not tried, or it's not user friendly, and you push it out, your teams are going to be more resistant to not wanting to use it properly or at all. So I think it's really important to engage your teams that you're working with to make sure that they're familiar with it and that it actually works.
That's a great point. And I think that segues really nicely into this whole idea of about team training and about helping people have this awareness, right, of high consequence infectious diseases, about any infectious disease, and how we kind of encourage that thinking. I think we refer to the identify, isolate, inform model a lot, right? Where we want to make sure that people are having this suspicion always. Could this be something infectious? And then making sure that they know how to isolate, how to protect themselves, and then making sure they know that they're passing that risk along, or not passing the risk along, but passing the concern about that along. And eventually, of course, that becomes informing all sorts of other people. But we refer to the identify, isolate, inform, but it's really that first thinking and trying to train people up for that. So I'd love to hear about strategies for the III model and beyond.
I think for us, it starts, at the call taking component. So training our communication center staff when they're doing a triage, that we're looking at, do they have a travel history? What type of symptoms they are. And when we know that there are active outbreaks or situations where we need to be concerned for travel history or symptomatology, that they are getting real-time updates to know when to flag a triage to escalate it to our clinical on-call person so that we can have a discussion about the symptoms, maybe the travel history, and then we're able to involve our hospital infection control leads in that discussion to determine, is this a patient that we're concerned about, or do we need to switch modes here and think about getting them into an isolation room after transport? Then moving into making sure, we're not in a controlled environment and we're limited as far as what resources we have. And as we've mentioned, the PPE has to be able to meet the demands of our environment. So I think continuing to make improvements about what we have available and then how it's used is really important.
Yeah, and it's certainly not all created equal, even from a what's required. We go back and forth about this in the hospital setting because people see things like coveralls and think, oh, well, that's what I want to wear. From my perspective, a coverall takes a huge amount more training to get somebody up to a level of competence, putting on and taking off, especially a coverall safely. And the last thing you want to do is have somebody's PPE put them at more risk. So yeah, you're right. It's not just here's something, use it. It's what does it cost? Can I keep it on hand? Does it work for people? And how much training does it take to get people to the point where they can use it really safely and know when to use it?
I can't tell you how many coveralls we went through, taking them on and off, different methods of getting out of the coverall so you're not contaminating your neck. You're right. The coveralls are probably one of the more challenging pieces of PPE to get on and off safely. So,
yeah. Liz, what about y'all?
As I mentioned earlier, I'm very fortunate to be a part of the RESPEC. So Denver Health is the RESPEC for Region 8. We are a hospital-based EMS agency. So we work very closely with our in-hospital partners to train and to really drill down the identify, isolate, inform. We've actually taken that to a pre-hospital route to where Chad's exactly right. It starts with dispatch. Our dispatchers are actually a part of our division. So we have good communication and good training with them as far as turning on and off travel screening questions and understanding what that means and what the relevant information for our paramedics actually is. I think in addition to that, then it's not only training our team, which trains quarterly in donning and doffing and SOPs, and they are experts in the field, but figuring out how to train the rest of our paramedics. We are a 911 system. So I have 300 paramedics here in Denver that we're training on as frequent as we can. It starts with when they first get hired here at Denver Health, they go through lectures as far as PPE and paying attention to some of these pathogens and cooties, as you've mentioned, and how to stay safe. So it's then relying on my team, who are the experts and who are their peers, to really champion and drive that message home that it's important. We need to pay attention and have thoughtful conversations about why we use certain things in certain situations.
I love that. And I love that you're sort of fostering that environment of safety, right? Like that there's this expectation driven by maybe your specialized team, but into all of the rest of your medics. Because I think that's a challenge. I'm sure a lot of folks say, well, sure, if what you're doing is just special pathogens transport, you should be prepared. But what about the rest of us? I think about across the country. I started my career in a little rural emergency department, a 36-bed hospital with a 6-bed emergency room. And, I knew every medic in the county based on their voice over the radio. But, I can't imagine trying to keep every first responder, every medic trained in something, because it would just be such a huge undertaking. So I wonder, are there strategies? Use sort of like a train the trainer model, right? Where you're sort of doing some that, I guess the term now is force multiplying, right? So you tell 10 people and they tell 10 people. But what are some of the other strategies that we can use or employ to get people to where they are protected?
I think, we've mentioned one resource already, the infectious disease playbook. So giving people resources, I think, is really important. We have protocol books for all of our other clinical care that we provide. So giving them resources for these nuanced situations. The NETEC EMS website is also a great option. It has lots of information there. So getting the right resources to the people that are working in the frontline areas to make sure that, not only do they have that initial training and maybe quarterly or however your program works, but they also have additional resources in a situation where they might have a question, or do they know who to call to get help if they need help, how to escalate.
No, that's a great suggestion. And again, we'll promote those links. And I think it is, like you mentioned, who are you going to call? Like who's your source of truth? Where do you turn to? You both mentioned sort of this idea of the countries of travel. Like who should we be concerned about? Where did they go? But I would say from a medic standpoint, if you just got off a cruise ship and you have nausea, vomiting, diarrhea, fever, honey, I don't want that. It doesn't have to be loss of fever. I don't want it. Right. So I think some of that, like this idea of, okay, there are some clues that would just automatically say you need to, back up, make sure you're taking care of yourself. But how do we convince people that the ensemble that is chosen or that's assigned or that they're given works for what they're supposed to do? How do we help people believe that if they do these things, they'll actually be protected?
I think a lot of it comes down to constant communication and education. It's even the 5-minute sidebar conversation with medics, at the emergency room, sort of talking about, hey, were you wearing your PPE? Do you know why you're wearing your PPE? Just sort of asking those questions to clarify and gain better understanding. I think the more communication we can have, the better. We also facilitate that communication with our fire department and police officers here in Denver who are also exposed to these patients, and understanding that the PPE can help them stay safe as well, and what their PPE needs are based on what their job is compared to our paramedics who are a little bit closer contact or doing more invasive things with our patients. So for me, I think it's just a constant communication, not waiting until we're in the middle of a pandemic or we're in the middle of an outbreak. We're always having these conversations, and we're always educating and asking questions and trying to get the information out there so that it is more normal and it feels more normal when it comes down.
Do you guys feel like paramedic education, the formal side of it, right? Not the less formal that you're doing, with your companies, but in your training programs, is PPE covered much? I mean, I would say, I probably am too old to remember my PPE nursing education, but I think from the precepting I've done of new nurses, I would say they just don't get much in nursing school. It's just not something, maybe they feel like hospitals will cover it when you get to your job, but it doesn't feel like people are coming to the job with a lot of baseline information.
Yeah, I would agree. Here, we actually have a paramedic education school attached to Denver Health. And I know that even being involved in that, I would love that there would be more PPE education. They do get kind of the baseline introductory, lecture of this is why you should wear it and this is what you should wear. But I think, again, that continuing as they progress along their career is one of those opportunities that we could capitalize on more to really gain a better understanding of why we use what we use and when to use it.
I would echo what Liz has said. And I think we saw during the pandemic that if we can give examples, then during the pandemic, we were able to show that those basic infection control practices and the PPE worked. We had a really low incidence of healthcare worker infection on our team during COVID. And the times that we did see it spike were when the hospital was making changes, like they were relaxing masking requirements and whatnot. So you see the changes, and so your PPE is working effectively. And then once things start to lighten up a little bit as far as requirements, then you see kind of a shift in your healthcare worker infection. So I think we were able to really show that the PPE methods that we were using and that we maybe tried they worked. And that, I think, made people feel better and more likely to take part in using it properly.
Yeah, absolutely. And it's funny to me how many people will rely on like a provider, like a physician's advice about PPE. And I'm like, if you had any idea, you think we didn't get much education about PPE? Let me tell you, those poor physicians really, they just don't get much at all. So I feel like I knew almost nothing about PPE. I wore what was handed to me, or it was in my closet at work, or my PPE cart. and you just assume that it's going to work. And it wasn't until my Ebola experience in 2014 that I was like, oh my gosh, I don't know enough about this. I need to educate myself. And it was sort of funny because I don't think most of us think of ourselves as like gullible humans. Like, I don't think you can go through emergency medicine or critical care medicine and really be like oh yeah, I believe everybody. We're just not the kind of people. But here I was just saying, okay, yellow gown, sure, that's what I'll wear. And now I think, well, that's fine. There's something's just a dry foam mite, but it doesn't work for anything wet. Like I want people to know what to use and why, like why you need that piece. And I think a lot of us are more likely to be compliant, as you've said, if we have a part in making decisions, we understand what we're using it for, and we know like the qualities that we're relying on are there. Yeah. So important. So important. What do you say to folks that say, look, we would love to train more on PPE, but it's just too expensive? Are there some strategies? Do you guys reuse training PPE? How do you make that not such a burden?
We would definitely reuse our training PPE. So we have a whole cage of equipment that is training related, separate from our actual activation supplies, so that we're able to save a little bit of money there. Obviously, we're fairly lucky to be part of Respec Center, so we get maybe a little extra money for training supplies. But I think finding things that maybe you don't have to use PPE, maybe you're talking more about the why, Jill, as you mentioned, like why are we wearing this type of PPE for this type of pathogen? So maybe it's not a situation where you're using PPE at all. You're doing a presentation and running through the whys of several different pathogens and why it's important to do this or not do this. So I think that's maybe where you can save a little bit of money. Because I think we're all type A thinkers, a lot of us. So we want to know that why.
I agree with that for sure.
Yeah, I completely agree with Chad. I think that we also reuse our training PPE here internally. We do some trainings with external providers, other agencies around Colorado. And a lot of that is, well, what do you have? It's a lot more conversation based. What do you have available? How much do you have available to you? How can we come up with creative ways to be comfortable and confident in donning and doffing your PPE without necessarily wasting it in a training opportunity?
Yep. No, it's a good point, because I think you're right. There could be some things like maybe you don't use, if you've got 2 gowns and one's the really expensive one, like Chad, you were mentioning you went to a surgical gown. But if it goes on and comes off the same way as a cheaper gown, maybe you can use one for training and say, okay, it works the same. It's just a different material that you're going to put on when you're faced with X, Y, or Z. Yeah. A great point. Great point. Yeah. I think it's so interesting about the heavy lift. I think a lot of people just assume PPE is very intuitive and we all know how to do it. But I think if everybody just thought for a second about, think of that person who's just an absolute hot mess in their PPE. People would be like, like somebody pings into your brain. Why is that? Because we all know somebody who just, like I was probably guilty of being this person, but like you get all gowned up and and then you forget something. So you're just going to tiptoe as if that's going to like reduce your burden of cooties on you. You're just going to tiptoe out of that room, or we'll see people not put on PPE and say, oh, I'm not going to touch anything. I'm just going to silence the pump. And you're like, oh, honey, you're just not understanding that you're having to breathe in that whole time.
I think that's been all of us, Jill.
Yep.
Whether we're in a hospital or we're reaching into the cabinet on the ambulance. Oh, I missed one thing up in the cabinet. I need to reach in and grab that really quickly.
Yeah. Not wanting to think about what you're taking in with you. Yes. It's gross. All right. So I'm just so happy to have this conversation with you guys. And I want to sort of hear about, we'd mentioned when we were talking about this episode, sort of these sort of broader principles. And I think the first one to me is just like what we wear PPE for, like, basically it just is divided into 2 big concepts of what your PPE does for you. It's the direct, like splash, inhalation, spray, whatever. And that could get into like cuts in our hand or all the little things we have that make our skin not intact. So gloves, eye protection, respiratory protection. And then the rest of what we wear, whether it's a coverall or gown or whatever, for the most part is meant to keep stuff from transferring onto our own clothes or onto the environment. And that's why it's so important to know when to take it off. But, like those sort of big concepts, I think one of the phrases that somebody used was operationally sound. And I think that gets back to what you guys mentioned at the very start. Like, does it work for what you're going to be doing in the back of a truck or out on the tarmac or Liz in the snow? I'm sure nobody's got less predictable weather than Denver. I can't imagine how you guys, you need snowshoes 1 minute and like a swimsuit the next, and it's just crazy. But like that whole idea of PPE needing to be operationally sound is really interesting.
Yep. I think just reiterating what we've already said, you have to know what works for your team and your transport configuration. What type of transports are you doing and what type of staff you have? Like, do you have the right sizes? Does somebody need like a 2XL exam glove? We have people that need larger size gloves. So knowing those things, I think, is really important to supporting that being operationally sound.
Yeah.
Yeah. And I think EMS is very unique in the sense that no two EMS agencies are the same. Even if they try to copy each other, they're not the same for one reason or another. So either the back of their ambulance looks a little bit different, their personnel is different, their uniforms are different, their response areas are different. Even here in Colorado, I work in the middle of the city. I don't respond to rural areas that need 4x4s to get to and get patients out of. So understanding those unique considerations for each agency is really the only way that you're operationally sound. I have conversations quite frequently with other agencies that want to just mimic and match what Denver Health does. And I discourage that as much as possible, in the sense that what we do here may not work for you in your area, and they may only be 50 miles away from us, but it's a totally different setup. So I think that's really important for people to understand that there's not a one size fits all when it comes to PPE for EMS.
Yeah, it's a great point. And I think this idea that you need it to be, as we said, sort of operationally sound, and that situation is going to differ, and then trying to get people to the point where they're proficient with that and they understand. So you have to have the stuff, like it's our famous sort of staff, stuff, and space, right? You have to know where it is. You have to have the right stuff, and you have to have people that are trained and know how to use things. And so that sort of idea of proficiency, soundness, and appropriateness for the pathogen or, your suspected pathogen. It's a lot. I mean, it sounds so easy, but it isn't. It's really a complex situation that requires, obviously, you guys are training all the time. It requires a tremendous amount of effort to keep up and to keep people ready. Wow. I just want to say, I think this is so important a conversation, because when we think about preparedness, it's really a system, hospital to hospital, facility to facility, state to state, region to region. We don't exist as little islands, right? We have to have EMS to go in between. And I think that many times people focus on what a facility is doing, but they don't focus on how people are getting in between all these places. And yet, so many times, y'all are going to be the ones out there experiencing things first. You sounding the alarm, hey, this person might have something, helps protect every other chain, every other event in that chain. And that could be people like me at the hospital or the next medics that you're handing off to. And so it is so important that we all kind of share information and resources when possible, but also just this whole idea of protecting ourselves and each other. All right. Last thoughts from either one of you? Anything you really want to make sure that you drive home message?
Thanks for having us. And I think, Jill, probably what I would say is one of the most important things is know who to reach out to. There is the wealth of information with the respect probably that's closest to you. For me, Region 3 and Liz, Region 8. So know who the closest resource is for you. We all learn a tremendous amount of information from each other. I think that is, we see, oh, Liz is doing something this way. That's something that is adaptable to us, or we're not necessarily doing the same thing, but if we modify that. So just know where your resources are and know how to access them, I think is what I would say is the most important part of this.
Excellent.
I would completely agree. Know your resources, know who to reach out to. And I think the other piece of that is don't be afraid to ask for help. As we've sort of highlighted, PPE is not something that any medical provider gets a ton of training on. So understanding that you're not unique and not understanding what PPE is maybe meant for, don't hesitate to reach out and ask questions.
Yeah. Answering the question, am I protected, is not as simple as it sounds. And so it's understanding what to use, why you're using it, how to use it right. Fantastic. Well, thank you guys so much. This has just been a pleasure. I love doing this. I learn something new all the time. It's so exciting to talk to folks that really are out there doing an incredible amount of difficult work. Here we're headed into summer. Y'all talked about the difficulties of heat and PPE. And I hope for your sakes and the sake of your teams that you don't have a lot of highly infectious disease patients in the middle of a heat wave, because boy, howdy. I had trouble tolerating PPE in 72 and fluorescent. I can't imagine doing it in 95 and humid. So God love y'all. Well, thank you guys so much. Thank you for joining us today to discuss EMS and PPE and really this idea of how we can make those early patient encounters safer for our medic community. So I'm really grateful.
Thank you for having us.
Thank you, Joe.
All right. So for those of you listening at home, thanks for tuning in to this episode on PPE and EMS. We hope you'll join us for future episodes on a wide range of topics, from healthcare worker safety, personal protective equipment, of course, and even more about infectious diseases of all kinds. If you have any questions for NETEC or ideas for future shows, please feel free to contact us at info@netec.org or find us on the web at NETEC. That's netec.org/podcast, where you can subscribe to future episodes and find more information on today's topic, including the resources that we've talked about today. Thanks for joining us, and we'll see you next time on Transmission Interrupted.
You've been listening to Transmission Interrupted, a NETEC podcast, produced and edited by Benjamin Madsen, with additional support provided by Britton Clark, Veronica Lavaro, Jason Noble, and Lisa Stone. Special thanks to our guests and the subject matter experts at NETEC for their insight and guidance. This podcast is supported by the Administration for Strategic Preparedness and Response. For more information, tools, and training on special pathogen preparedness, visit netec.org. And don't forget to subscribe, rate, and share the show on Apple Podcasts, Spotify, or wherever you get your podcasts. Thank you for tuning in to Transmission Interrupted.